This is Top of Mind on BYU Radio. I'm Julie Rose. Thanks for tuning in today to Sirius XM Channel 143 and BYURadio.org. In the United States, men take their lives at 3 to 4 times the rate of women. And one reason is the stigma still attached to seeking help for depression when you're a man. Well, Dr. Rich Mahogany has a message for guys who think real men should not talk about their feelings.
There are a lot of things a man should never do, like slap fighting, pony riding, manscaping, skipping, breaking a sweat on an elliptical machine, and, of course, referring to runs in baseball as points. But being open and honest about your life and your problems with your friends and relatives, well, that is one of the least unmanly things a man can do. So, share away, gentlemen. This is Man Therapy. I'm Dr. Rich Mahogany.
Man Therapy is a public service campaign, and Dr. Rich Mahogany is not a real doctor. But his purpose is very real. The character and website were developed with public health officials in Colorado to tackle mental illness in men. I'm joined by Joe Conrad, who is CEO of Cactus, the ad agency that came up with the campaign. Mr. Conrad, hi. Thanks so much for your time.
Hi, Julie. It's great to be here. My pleasure.
Who or what was the inspiration for Rich Mahogany, the character, in this campaign?
He was just the brainchild of our agency and our creative team, and it was the result of a lot of hard work put into trying to figure out the best approach to this. But we knew that we wanted to use humor, and we felt like developing a character would be the way to do that. And then it was really all about trying to personify him. What does he look like? What does he sound like? What's his tone and voice and personality? And so we created a description, a persona, if you will, and then we went out and cast for him among actors and found our guy who was a stage actor who brought so much to the role and really brought it to life.
What are this character's defining qualities, would you say?
Well, he's a guy's guy. He's certainly somebody that you can enjoy hanging out with, catching a game with. We've described him as part doctor because he is, a fictional therapist, but, he very much cares about your mental health and your well-being. But he's kind of like a football coach. He'll give you a pep talk or a kick in the pants if you need it. He's kind of that buddy that'll come out and hang out with you when you're having trouble. And he's also an action hero. He's about taking charge of your life and being proactive and taking charge of your mental health. So those are some of the characteristics, I think, that went into developing him.
He's got an impressive mustache. He reminded me when he sits at his big, I don't know, what is it, mahogany desk maybe? He reminds
What else?
He reminds me a little of the Parks and Rec character Ron Swanson. I don't have any patience for frilly, froofy stuff. We're here just to get down to business. I'm going to tell it like it is.
Yeah, we really strike a balance between, having fun and entertaining people with really great, rich content that's well produced, but also there's a serious tone to it, and there's a serious message, and he knows when to turn the corner, like in the radio clip that you played, and turn the corner and be serious and take a different tone and get guys to talk about and think about, really, some very serious issues. And so it really is kind of an artistic balance, and I think our team did a nice job of finding it.
What was the charge that you were given when this campaign came to you? They didn't come to you with the idea for Man Therapy. I'm sure it was what? What was the problem that you were asked to try and solve?
Yeah, it's definitely the most fascinating campaign work that we've ever been involved in, just because of the nature of the assignment. We worked with the Colorado Department of Public Health and Environment and the Suicide Prevention Office, and they, like every other state in the country, were alarmed about the rising rate of suicide among working-age men. And so they just knew that they wanted to try to do a campaign to try to have a positive impact on that. So they had no predisposed way to do that. They didn't really even have a budget to do that, so we really cobbled together a lot of partners and called in a lot of favors. But we knew that it was an issue. When we started to look into it, we couldn't find any campaigns that had been done around the world, for that matter, even especially in the U.S., targeting this population. And there was such a need for it across the entire country. And so that really was the impetus to try to develop a campaign to have an impact on this. And I really felt like we met our match. Over the length of my career, I've always felt like communication and creative and digital can solve many problems, but I felt like we had met our match when it came to suicide because it's such a complex, serious issue. We asked ourselves, can an ad campaign, can a website actually positively impact this issue? And I knew we had our work cut out for us, and so we really took to it just like we take on any client and brand that we work with, and following best practices to deploy a campaign. And I think by doing that, by bringing that professional, creative approach to solving an issue like this, we really struck gold.
What was it that convinced you, though, that the reason that men weren't getting the help they needed for depression and suicide risk, the reason they weren't getting that help was because somebody wasn't telling it to them right, because the tone wasn't right, that they needed a little humor? How did you become certain that that was the way to tackle this question?
Yeah, we looked at a lot of research that had been done before and tried to learn from that. We also brought together a group of suicidologists and experts from around the country to serve as a sounding board and kind of a think tank to work through it with us. But then we did our own research. We actually talked to men and survivors and their loved ones and really tried to understand the issue from that perspective. And what we uncovered was the big aha was that it wasn't really for a lack of resources. There's a suicide prevention hotline. There's crisis chats. There's services for the military and veterans to get help. So it wasn't really a lack of resources, but where we weren't connecting is further upstream. In other words, engaging guys, getting them to think about it earlier on when things are going on in their life, and then encouraging them and normalizing self-care and resiliency-building skills for guys to kind of be aware, take charge of their life, and then do something about it. It really was more that top of the funnel where they weren't thinking about it. It was just something that they were enduring, and they weren't connecting the dots, that feeling stressed and depressed and having an alcohol abuse issue, things like that in their life, if gone unchecked, could really spiral and put them in a dark place. And so we wanted to go upstream and help guys better understand men's mental health, that it's an easy thing to engage with. It's something that everybody can do, learn about themselves, and then make it easy for them to take action and do something about it in a proactive manner.
So I want to play another clip from the website. You on the website, you have kind of the entry point for man therapy. It's mantherapy.org. The entry point is a 20-point head test. I guess it's modeled on the idea of getting a 20-point inspection for your car or something along those lines, right?
That's right. And
it tries to assess your basic mental health. A lot of the questions are very much along the lines of, do you get angry? And do you ever get violent when you're angry? And do you sleep a lot? And do you have hard time falling asleep? And do you feel hopeless? It seems like it's all the sort of the standard questions that you would ask to assess somebody's risk for depression or suicide. Am I right about that?
Yeah, you're absolutely right. We took, that best practice and those screening assessment tools, and then we brought it into the Man Therapy voice and tone. And so all the questions sound like they're coming from Dr. Rich Mahogany, and it's part of the therapy service that he provides on his website. So we really wanted to make sure that we built a portal where therapy is actually happening. If you think about it, if you go somewhere and you learn about men's mental health and you learn more about yourself and your particular issues that you're wrestling with, and then we lead you to resources to do something about it, we feel like that therapy, at least that engagement part to start the process, is happening on the site. And so the way it works is on the 20-point head inspection, when you click on it on the site, Dr. Mahogany will do an intro video, and says things like, welcome to your appointment, take a knee. And he really encourages you to be very honest with the survey, because if you're not honest, it's not going to be accurate. So after you take the 20-point survey. It takes about 5 minutes. You're given your results. So we have a printed results, and those are also kind of in the Mahogany tone, where he kind of points out areas of your life that may be out of balance and some that you should take some action on. And then you can actually watch a video, depending on what class you fall into, from, hey, things are great, keep up the good work, I'm a little worried about you, check out a few recommendations, or there's one, the most severe response is if he is worried about you and you've answered some questions that cause alarm, he breaks character and says, hey, even if a fake therapist is worried about you, you really should do something. So get help, call somebody today.
I want to actually play a couple of clips from those exchanges, because I think it's a really good illustration of the tone, how you're trying to balance the cheeky, but also this is serious business. So let's start with the low risk. If somebody takes the 20-point head test and it turns out that they're in pretty good shape, this is what you might hear from Rich Mahogany on the website.
Outstanding news. You appear to be in ideal mental shape. Your brain is so healthy it probably has a flawless complexion and a freaking six-pack. But, as those of us with actual abdominal six-packs know, you don't get this without putting in the work. So, I don't want you and that remarkable mind of yours to rest on your laurels. I've written your results on an official-looking piece of paper. Read 'em, because they include a gorilla-sized handful of masculine techniques you can use to maintain your health.
Okay, so Joe Conrad, give me an example or two of the masculine techniques that Dr. Mahogany recommends for maintaining your mental health.
Well, we think therapy comes in many forms. So there's a number of videos that we do that have health tips. One is around cooking. Another one is around yoga. Another one involves a breathing technique that is very relaxing. We also have just small tips for guys and things that they can do on their own, kind of do-it-yourself tips that fall into a number of different categories. We have dozens of content partners and apps and resources that we have curated or created that we've added to the site. We've made it easy for you to be able to find a therapist in your community that's a perfect match for you. We have other therapy solutions and book suggestions and activities, and a lot of it is self-care, but then we also connect people to professional care when the time is right.
Okay, so let's listen then to the high-risk result. If somebody were to take this 20-point inspection, head test rather, and it's worrying, this is what they might hear.
So I'm going to tell it to you straight. Your results have me worried. And needless to say, if a pretend doctor like me is concerned about you, you probably should get some help. On your results, I go into greater detail of what I think your problem may be, and I give you some suggestions for viable solutions. Please consider them and get yourself better.
He also goes on to say, if you feel like you might harm yourself or someone else, please push the red button, make the call the hotline. Joe Conrad, do you have any evidence that men have actually seen that message and done something to help themselves?
We absolutely do, Julie. It's been because the website is kind of where all the activity happens, using Google Analytics and then analyzing that. We have a lot of that data that's been very interesting. So we launched on July 9th of 2012, so we're coming up on our 5th anniversary. And over that time, we're approaching 1 million unique visitors to the site. The average time on site for each visit is about 5 minutes, which is remarkable that it's still hanging in there at that engagement level. We've had over 220,000 men take the head inspection. We've had about 30,000 people click on the red phone to get information about that. So we're not sure of the actions that they're taking outside of that, but we also get a great deal of feedback, emails and notes and letters. When we launched on July 9th, 2012, I got an email routed from Dr. Rich Mahogany to my own email box, and it was from a combat veteran in Baton Rouge, Louisiana. And because Man Therapy is a website, we launched with an article in the New York Times, and so because of that, it quickly spread around the country and around the world. And here was this combat veteran who had just heard about it and went to the site and wrote this long, thoughtful note and said he was going to share it with people. And that's when we realized, wow, this is real. There's other people. There's real people out there. And then probably the most profound piece of feedback was we got a voicemail at our office from a gentleman in Michigan who said that the website saved his life one night, and he kind of broke down when he was relaying the story. And so we've connected with him and have found ways for him to participate in the campaign. So we also are undergoing a study at the CDC, a man therapy research study. We're 2 years into a 4-year evaluation, so we're really excited to get those results as well.
What do you think is the secret to the success that you just described?
I think part of it is just putting a billboard up in a community that says, hey, guys, you can't fix your mental health with duct tape. And this quirky guy, man, and with a mantherapy.org, just by putting that on a boulevard and out in the community, and it helps normalize that conversation. And I think that really is the essence of it. And, of course, we wanted to not shy away from the stigma around it. We wanted to bust it and go right through it. So that's why we call the campaign Man Therapy, because it comes in many forms. It's nothing you should be afraid of. It's just like going and getting a broken arm fixed, and it's approachable. So I think just putting it out there, first of all, but then doing it in a way where we borrow a page from, the brands and hamburger, whether you're selling a hamburger or a hospital or a bank, you really, want to put out great creative that motivates people, that makes them laugh, that engages them. And we felt like this issue deserved that same approach, and I think that's why it's working.
You think the humor, it wouldn't have worked if you had just done a campaign that said, men have feelings too, and it's okay to talk about your feelings, and therapy comes in lots of forms. If you said just the things you said to me there, that wouldn't have been enough to break through whatever it was that was keeping a lot of men from asking for help. You needed the sarcasm and a bit of the humor.
Yeah, it needed to be a little bit provocative and unexpected. We had looked at many of those ads in our research, and it was the head in hand, wife consoling the guy, types of ads that you've seen before that are easy to ignore. And, it's true, guys are very set in their ways, and they're very hard-headed sometimes. And in order to, I think, shake that up, we wanted something that was provocative, that pierced that, and kind of created a place where they could feel comfortable, that was, created just for them, and maybe a bit unexpected, and help them approach the topic in an engaging way.
Do you have any idea if the men who are going to mantherapy.org and watching some of these videos may be getting a little bit of help, if they're doing it secretly, that they would never admit to anybody that they were doing this? Or do you think they would say to a buddy who they realize is maybe having some trouble, hey, you should check out this website, if they'd feel comfortable doing that?
I think there's all sorts of interactions with the million unique visits. I'm sure many of them we know have been from loved ones of a concerned mother or a concerned wife or sister, but it's also guys going there on their own, probably from work or late at night. It's anonymous. It's available 24/7. You kind of turn to the internet and Google something, and we've done really a great job with Google grants that we've gotten that allow, when somebody types in certain keywords, Man Therapy will pop up, and we've driven a lot of traffic. So when guys are looking for, male depression or suicidal thoughts, if you Google that, Man Therapy will come up right there, and then we're just a click away. So it's very accessible. It's anonymous. I think that that's a big part of it.
Joe Conrad is founder and CEO of Cactus. It's a Denver-based ad agency. The force behind mantherapy.org, and Dr. Rich Mahogany. Thank you very much for your time today and for the work you're doing on this, Joe. I appreciate it.
Julie, thank you so much. I appreciate it.